HIV/AIDS pandemic. In the 1980s and early 1990s, the outbreak of HIV and AIDS swept across the United States and the rest of the world. Though the disease originated decades earlier, the most widely accepted theory is that humans contracted the virus by hunting certain species of chimpanzees that carried the virus, and then eating them or getting their blood in an open wound. You can get or transmit HIV only through specific activities. Most commonly, people get or transmit HIV through sexual behaviors and needle or syringe use. Less commonly, HIV may be spread from mother to child during pregnancy, birth, or breastfeeding. In extremely rare cases, HIV has been transmitted by receiving blood transfusions, blood products, or organ tissue transplants that are contaminated with HIV. Approved the first protease inhibitor beginning a new era of highly active antiretroviral treatment, or HART. Once incorporated into clinical practice, HART brought about an immediate decline of between 60 and 80% in rates of AIDS-related deaths and hospitalization in those countries which could afford it. In July 2005, the Joint United Nations Program on HIV/AIDS, or UNAIDS, negotiated with 5 pharmaceutical companies to reduce antiretroviral drug prices for developing countries. In September of the same year, the United Nations adopted the Millennium Development Goals, which included a specific goal to reverse the spread of HIV. In June 2001, the United Nations General Assembly called for the creation of a global fund to support efforts by countries and organizations to combat the spread of HIV through prevention, treatment, and care, including buying medication. In January 2003, President George Bush announced the creation of the United States President's Emergency Plan for AIDS Relief, a $15 billion 5-year plan to combat AIDS, primarily in countries with a high number of HIV infections. Africa is the continent that has been most affected by the HIV/AIDS pandemic, compared with other regions of the world. Sub-Saharan Africa has the highest infection level, the lowest level of access to care, and the least economic stability. In May 2007, the WHO and UNAIDS issued new guidance recommending provider-initiated HIV testing in healthcare settings. This aimed to widen knowledge of HIV status and greatly increase access to HIV treatment and prevention. AIDS cases mostly have been heterosexually acquired. Infections through blood transfusions and transmission from mother to child have also contributed to the spread of HIV across the continent. By the year 2017, more than half of the global population living with HIV are receiving antiretroviral treatment, a record of 19.5 million people. To have a successful prevention of the resurgence of the AIDS global pandemic, it is important to have an aggressive national intervention programs that include key components such as behavior change, communication, STD treatment, increased access to condoms, and increased access to HIV testing. In addition, mass media, outreach, counseling, and peer education have been used to increase awareness and life skills among young people, those with high-risk behaviors, and the public at large. It is the accumulation of these preventions that will put an end to the spread of HIV and its birth. In summary, prevention is a cost-effective measure for fighting the disease and countering the economic effect of HIV/AIDS on individuals, families, and communities. Methods of making therapies, including antiretroviral therapies, affordable must be sought, as the HIV/AIDS epidemic continues to devastate the global community. Increased prevention and care effort must be addressed to strategies to prevent new cases of HIV and to help those who are